When you do take trach care, you need to gather all your equipment so that you can be ready to do that procedure with efficiency. In order to do that, you're going to need blankets. The purpose of the blankets is for safety and positioning. The blankets are used for swaddling. If the baby is really active and agitated, you're going to want to swaddle the child. If you want to put the child in a position and extend the neck just a little bit to have better visualization, you're going to want another blanket that you can put, or a towel, right under their shoulders. I put here a sanitizing to emphasize how important it is to sanitize your hands. I strongly encourage everyone to first wash their hands, but again, we do have that sanitizing gel available. The next thing, you're going to use a Trach Change Kit. Not all homes are going to have a Trach Change Kit, but this gives you an idea of what you're going to need. You are going to need a special Trach Change gauze. You cannot use just any gauze because you do not want the fibers or anything to be cut or loose. So you're going to use a special trach dressing gauze. You're also going to be needing some applicators. This is what you're going to be using to clean around the trach. In this trach kit are also twill tape. Sometimes a twill tape is used as a trach tie, so we have that available as well. The next thing that you're going to need is you're going to need to make sure that you have containers to do the suctioning. And so you need a container as well with clean soap and water or saline to do the dressing cleaning around the skin site. And then you need clean water or saline to rinse it. You will also need some dressing or a towel to pat it dry. The next thing you have to be aware of, you're going to have a step-down trach. And I have here an example, a box, step-down trach. I've also taken out an obturator to show you that this is what you use to be sure that when you suction, you do the appropriate depth. You do not want to go too deep. And so this you can use to see how deep that you would suction. The next thing that we have here is an Ampule. It's normal saline, and this is used to lavage the client. Now, not all children get lavage. A doctor orders it, but it's something that's put in the trach that loosens up the secretions. You want to have a trach tie available because we are going to change the trach tie when we do the dressing care. It's very important, of course, you have to have a suction machine available and your suction catheter. And as I was telling you, the suction catheter is going to have markings on it so that you can measure it. And to measure it, you take the obturator and you bring it here, and we can see right here the marking, it is 6. So now we know how deep that we would go into this child's trachea. This is the tube, this is the control valve that helps us to get suction, and also this is the end that's going to be suctioned to the tube attached to the tubing of the suction machine. We never touch the tip of the catheter. We try to keep that in our hands so it stays clean and is not contaminated. Often in the home they use clean technique, and they will return that and put that in the package. You must have gloves. You always wear gloves when you're going to do anything that has any type of body secretion, so you're going to need your gloves. And the Ambu Bag. The Ambu Bag is very necessary because often, remember, we're going to occlude that airway when we're going to go in, so they might need some mechanical ventilation. We have our Ambu Bag ready. And then, of course, we want to have a place that we can dispose any dirty dressings or ties.